Hello, welcome to my channel. Today we're talking about therapeutic communication, and this is part 2. These are questions and answers from RN Inclex. Please hit the like button, please subscribe, and please share this video. My first question: why do we use open-ended communication instead of closed-ended communication? And the correct answer is we're giving patients a chance to elaborate and explain using open-ended communication. My next question is about avoiding aggressive behavior. What does avoiding aggressive behavior means? And the correct answer is avoid aggressive behavior. One nurse to another in the workplace, or avoid family violence, patient or patient's family on the floors. What is the definition of aphasia? And the correct answer is loss of ability to understand or express speech. Example, in stroke patients, seen in patients with brain injury, trauma. The next question: what is interpersonal communication? Interpersonal communication. The correct answer: this occurs between two or more people. We'll see interpersonal communication, for example, in staff meetings or in support groups, group therapy. Next question: what is group dynamics? What is group dynamics? And the correct answer is group dynamics involves how individual group members relate to each other is your correct answer. My next question is: social relationships differs from therapeutic relations. How? How does social relationship differs from a therapeutic relationship? And your correct answer is both are focused on both participants. The goal is to meet one's own personal needs is the correct answer. Next question: what is self-talk? Correct answer: self-talk is positive because it can affect the nurse's behavior and enhance or distract from positive interactions. The next question: what are our communications with children? What should we know when we are communicating with children? And the correct answer is children uses calm, quiet, friendly voice. Children are responsive to nonverbal messages. Children may become frightened by moments of unexpected gestures. What do we know about communicating with the elderly is your question. And the correct answer is elderly may need more time to answer questions is your correct answer. What do we know about communicating with patients who are hard of hearing is your question. And the correct answer is use pleasant, normal voice to speak to elderly. Speak slowly. Use a gentle voice. Stick to one topic at a time when communicating with the elderly who is hard of hearing. What is the definition of congruent communication? The correct answer is incongruent communication. There is an agreement, a style of speaking that remains harmonious with feelings being experienced. What is incongruent communication? And the correct answer is persons' words do not match nonverbal communications is your correct answer. Next question, what is personal space? Personal space is 6 feet. In communication, we have our orientation phase, we have our working phase, and we have our termination phase. What do you know about your orientation phase? And the correct answer is the RN developed a trusting relationship in the orientation phase. The nurse talks about goals, expectation. The nurse develops a rapport with her patients. The nurse talks about rules, limitations. In orientation phase, the nurse develops respect. The nurse also set limits in our orientation phase. What do the nurse do in our working phase of this relationship? The working phase will be about the client's problems. The working phase is the identification phase. Problems are identified, solutions are explored and applied, and evaluated. What do we do in the termination phase? The termination phase, the answer is the termination phase is the resolution phase. In the termination phase, the nurse is terminating a relationship with this patient. Maybe this is the day of discharge, for example, would be your termination phase. This is the resolution phase. All your teachings you're reviewing on the day of discharge. You make sure your patients understand the instructions given. You read back your instructions. You make sure they understand how to administer the insulin, how to give themselves their injection. This is the resolution phase. This is the termination phase. This is the discharge phase. And no, this is always a test question. Termination phase begins during the orientation phase. So orientation phase, the day of admission, this termination phase starts during your orientation phase. For example, your diabetic patients, you cannot wait till termination phase, the discharge day, to teach them about administering their injections. You have to teach them from the orientation phase right down to the working phase. Teach them about their injection, make sure they have teaching, make sure they know about their medications. Some clients are taking medications from homes. Make sure you do a lot of teaching before they go home. They understand in the working phase how to do their dressing change. Okay, our next question is, so termination phase begins during the orientation phase. What are our barriers in communications? What are your barriers in communications? This is a question. The answer is barriers in communication leads to obstruction in communication. Barriers can be language barriers, cultural differences, setting in which care provider increases the workload and restrict nurses from discussing patients' concerns effectively. This can be a barrier. There is increased workloads. Maybe a nurse is sick, have to go home, and the nurse has to take additional patients. There is an increase in workloads, and there's a barrier of communications is reduced between the nurse and her patients because of work overload. Understaffing affects individual relationships effectively. So this can be a barrier also in communication between the nurse and her patients. There's understaffing, there's work overload. What is S-bar is your question. S-B-A-R, S-bar. S-bar definition: S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. S-bar is, for example, the right answer. S-bar is communication between one nurse to another nurse. Nurses going off, you communicate. The day nurse communicating to the night nurse. You're giving report in the form of S-bar. The nurse is going off, she's going to talking about the situations of her patients, the background of her patients, the assessment she did on the patients, what were recommendations made concerning our patients, and she's going to give report to the nurse who is coming on duty. Or if she's transferring one patient from one floor, maybe from med-surg to ICU, she have to give a report in the form of S-bar: situation, background, assessments, recommendation. You can give S-bar in the form of communicating, please note, to your doctor. Nurses communicate from one nurse to the doctor in the form of S-bar. It's a communication tool we all use. We speak to the doctor about our patients on the telephone in the form of S-bar. First, we start with situation when we are talking to the nurses or to the doctor. We state situations first. Second, we talk about background. Third, we talk about assessment. Fourth, we talk about recommendation. It's a communication verbal tool. It's a communication telephone tool. We speak in the form of S-bar in our telephone communications. What is a handoff? Is our question. Handoff is a communication tool, one nurse to the other, day nurse to the night nurse to the day nurse. We give a handoff report. We can talk in our handoff. The patient is NPO to the next nurse coming on. This patient is going for surgery in the morning. We can talk about the state and present condition of our patients. If it was negative, something happened, we state how was it handled. Maybe patient got sick and there was a med call. What did you do? The patient was sent to ICU. We gave the patient blood, diagnostic procedures, labs. Patient WBC was elevated in the form of diagnostic. We gave antibiotics. We sent blood cultures to the lab. Handoff in form of pain scale. Patient was given pain medications. The pre-assessment medication was 10, and 1 hour after giving oral medication, the post-assessment of your patient, your patient pain was reduced to 3. So handoff is a communication tool, one nurse to another. We talk about the state and condition, present condition of our patient. We talk about how it was handled. Potassium was low, we gave potassium. Magnesium was low, we replaced magnesium. Blood was low, we gave blood. Diagnostic labs was sent, we drew blood, we sent to the lab. Patient's WBC, we suspect the patient was having UTI, urinary tract infection. We sent urine specimen to the lab as ordered by the doctors. And for handoffs, we can talk about falls of our patient. When we're handing off to the next nurse, we can say our patients fell and the incidence was reported. We did an incidence report about the fall of this patient. We gave blood. There's a blood consent for blood is on the chart. My patient is NPO tonight. The the consent for the surgery was signed by the patient, witnessed by the nurse. The nurse is only a witness. Okay, next question. What is the 5th vital sign? The 5th vital sign is pain. Our vital sign is TPR, temperature, pulse, respiration, blood pressure. And the 5th vital sign is pain. Remember, when your patient is in pain, before you give your meds, you have to do a pre-assessment. Mrs. Jones, what is your pain scale now? Before I give you this med, this is your pre-assessment, it's a 10. After I give this oral medication, I will go back an hour after and say, Mrs. Jones, are you feeling much better now? How much is your pain now? 1 hour after giving you an oral medication, she will say, okay, my pain is much better. It's scale 4. This is your post-assessment for oral medications. And if you had given your patient an IV medication, you would assess the pain 10 minutes after. You would go back and say, post-assessment, how much is your pain now? For IV, post-assessment is 10 minutes. For oral medication, it takes a longer time to be absorbed. So you go back an hour after to do your post-assessment. The next question, patient is outpatient. What does that mean for outpatient admission? Outpatient admission means less than 24 hours. The next question, what is inpatient admission? Inpatient admission is greater than 24 hours. A patient can come in for outpatient admission and the patient isn't doing so well to go back home less than 24 hours, and the doctor will write an order, please let this patient stay overnight. The patient then transfer will be changed from an outpatient to an inpatient because the patient will be staying longer than 24 hours. Please hit the like button, please subscribe, please share this video. Thank you. And this was part 2 of communication. My next video will be on documentation. Thank you. Have a good day.